Tourette syndrome is a movement disorder that tends to come on during childhood, often in the first 10 years of life. It affects boys at a much greater rate than girls, and it does tend to get worse as people move into their teens. Tourette syndrome is characterised by motor and vocal tics or twitches. These patients often have uncontrollable twitching of certain parts of their body. They often make noises such as grunts or throat clearing and sometimes swearing. The effect of having Tourette syndrome on a child or teenager can be absolutely devastating. It can affect their ability to make friends at school, it can affect their ability to get an education and get a job when they finish school. Tourette syndrome is often treated successfully with medications once the condition has been diagnosed. Quite often the condition isn't diagnosed correctly, however. The most important thing in Tourette syndrome is to make the correct diagnosis. Once the diagnosis has been confirmed, patients can be treated appropriately. Fortunately, medications are often effective in Tourette syndrome, and patients do tend to grow out of this condition with time. However, in some patients, the Tourette syndrome is either so severe or so unresponsive to medications that we might consider doing something a little more drastic, such as deep brain stimulation. In those patients who either have extremely severe Tourette's that's so disruptive to their life that they're unable to function, or in those that don't respond very well to medications, deep brain stimulation should be considered. Selecting appropriate patients with Tourette's for surgery can often be quite complicated. These patients are often young, they're often in their teens, and they may not necessarily completely understand all of the implications of undergoing surgery. It's imperative that these patients are reviewed by a neurologist with some expertise in the treatment of Tourette syndrome. Patients often haven't undergone an exhaustive trial of medications, and quite often adding a medication or changing the dose can make a big difference and can avoid surgery. Once they've exhausted all of those medical options, we would look at offering deep brain stimulation. The emergence of deep brain stimulation as a treatment option in Tourette syndrome has been a relatively recent phenomenon. Small numbers of patients around the world have been treated, including at our centre. It's not clear exactly which target is best, and a number of different targets have been utilised. At this point in time, my preference is the Globus Pallidus Internus. This is based upon evaluation not only of my series of patients, but also of what's been published in the worldwide literature. Deep brain stimulation for Tourette syndrome is often carried out under local anaesthetic, but in some patients the violence of their twitches is so severe that it would make surgery impossible if they were left awake. So in those patients we may have to give them a general anaesthetic for the whole procedure. Because deep brain stimulation for Tourette syndrome hasn't been used for a long period of time, we don't have that long-term follow-up data that we have with other conditions. What we do know is that over a couple of years following surgery, patients tend to do reasonably well. Not all patients obtain a benefit, but certainly in the small series that we've seen around the world, including in my series, we see most patients deriving a reasonable benefit fairly early after their surgery. During the actual operation, we quite often note that the patient's twitches, their vocalizations, and some of their other symptoms settle down fairly quickly with stimulation. When we turn the stimulator off, those problems come back within a few seconds or within a minute or so. Deep brain stimulation for Tourette syndrome is an exciting development that offers hope to patients with a condition that's often very, very difficult to treat. By placing electrodes in the correct area in well-selected patients, we can often reduce the severity of their twitches and improve their overall outlook on life.